Well, kids across the country have been cooped up for weeks, if not months, because of the extended COVID-19 lockdowns, and it may really be taking a toll. A recent report from the England charity Childhood Trust warns that kids and teens may develop serious mental health conditions because of the pandemic, including PTSD. So we want to bring in CBS News contributor Lisa Damour. Lisa, you are a psychologist. That sounds really heavy. Serious mental health conditions, PTSD. I mean, yeah, you got to stay in the house. I think a lot of parents might be sort of surprised at the mental health toll that this whole thing can take on children. Should parents be on the lookout?
Absolutely. So what we know about this pandemic is that it's going to be difficult for all children, and that for some kids it may be devastating. Certainly if children are facing things like the death or serious illness of someone they love, or if they are in conditions where they're not physically safe, or if they're hungry because of the conditions in which they live, that means that they are coping with far more than anyone should be expected to cope with. And there's no question that they may suffer ultimately from anxiety or depression or post-traumatic stress disorder.
And in that case, you're talking about some sort of extreme pressures that the children could be facing. But, you know, I have a friend who has two daughters. One is basically an introvert and has actually been doing just fine, but the other one is not. She really enjoys her peer group, which she has not seen in months, and it's having an effect on her. And in Italy, they sort of did a study that revealed that children seemed to be more irritable. They had trouble sleeping. They appeared more anxious. On the surface, this might seem like, I don't know, maybe behavioral issues. But when it comes to things like PTSD or depression, kids show their symptoms differently than adults would.
Absolutely. And even if children aren't suffering from depression or PTSD, they're all suffering from chronic stress, which is in fact what we are all experiencing as this pandemic goes on and on. And if we think about what kids need, they need routines, they need predictability, and they need adults who are in good shape psychologically themselves. And the problem with this pandemic is that it has disrupted all of the routines the kids are accustomed to, disrupted their summer plans, all the things they thought they were going to be doing. We have very little predictability. Kids are asking, you know, when is it going to go back to normal? What should I expect about the fall? And we can't really tell them. And then, of course, the grown-ups who are responsible for taking care of them are at best worn thin. And many of the adults who are caring for kids are themselves feeling highly stressed, feeling highly anxious, or dealing with unemployment, or dealing with tremendous financial worries or other stresses in their lives. So it's one of those times where we are all feeling the weight of this, and that will then trickle down in terms of how kids experience it. Because the people who are in charge of helping them and taking good care of them, we are all struggling to bring our parenting A game right now, too.
So what are some of the behaviors or symptoms that parents should be looking for in their children? Because the children aren't necessarily going to say, I'm sad. So what should they be looking for, and what can parents do?
So the way we think about chronic stress is that when we are under it, we all start coping. And there's unhealthy coping and there's healthy coping. So what we want to look out for, both in our children and actually also in ourselves, is the use of unhealthy coping mechanisms. So this might be things like withdrawing emotionally, cutting people off, or in adults or teenagers, looking to substances as a way to regularly manage distress, or doing things that we know actually are not going to help in the long run, like taking a phone to bed and just scrolling and scrolling instead of sleeping, or not getting off the couch, or eating only comfort foods, or being totally cranky all the time, you know, managing emotional distress by taking it out on everyone else. So we want to watch for that in our kids, and we want to watch for that in ourselves. And then in terms of what we should be doing, we want to actually push towards healthy coping mechanisms. So these would be things like reaching out and getting good social support from the people who really prop us up well. We can do this, our kids can do this. It can be things like finding a happy distraction. One of the things we know from research on chronic stress is that having things that let you take a mental vacation from the stressors is actually really important. So whether it's a terrific book or losing oneself in a TV show or going outdoors, our kids need it and we need it. taking fantastic care of ourselves. This is where we get a lot of sleep, our kids get a lot of sleep, we eat well, we're physically active. Doing those things and helping our kids move toward those things will make a big difference. And I also want parents to know you can talk about this with your kid. Even better is to model healthy coping. So when a parent has a long day, they might come down from, a whole day of Zoom meetings and be like, oh my gosh, the day was so long, like I need a glass of wine. That's one form of coping that you're modeling. Or they might say, oh my gosh, the day was so long, who will go on a walk around the block with me? I just need to stretch my legs. That's another form of coping. So we can talk about it directly, but my number one rule in all of parenting is don't talk about it, just be about it.
I love that. That is news you can use. I know I use that phrase a lot, but I love it when we give people takeaways they can actually implement like right away. I have a kid at home who actually is doing just fine being alone, except, you know what, doctor, she shouldn't. She actually needs to develop her social skills. Prior to this, it was something that we actively pursued, putting her in environments where she could test and develop her social skills. If you're a parent of a child like that, what do you do?
There's a couple things you can do. First of all, they can actually socialize. It just has to be supervised. So, the summer's heating up. If you have a backyard, you can have a sprinkler in your backyard and invite a good kiddo over to join and run around through the sprinkler, a good 10 feet apart. That's a safe thing to do that allows for socializing. The other thing we should remember is that socializing and socializing effectively as a child involves building blocks, like being able to tolerate frustration or being able to wait or being able to take somebody else's perspective. We can be practicing those things at home with our kids, even when they are not necessarily able to then try out what they're learning on their friends. They can still build the skill set that will help them when they are better able to socialize.
Oh, that's good stuff too. You're giving us gold here, doctor. So I want to ask you about something that's happening in Canada and New Zealand. They're taking what they're calling the double bubble approach. As anyone who watches CBSN knows, I'm from Canada, so I have most of my family is there, and that's what they're doing. The extended families have come together to create a double bubble, which means they only associate with I think it's a group of, I think it's like 20 people now. And what it has meant for them is that the grandparents and the grand aunts have been able to interact with the children, help with homeschooling so the parents can sort of take a load off. And it seems to be working for them. Of course, you're not supposed to interact with anyone outside of that double bubble. And that's kind of like the key to it. I want to get your take on it. Do you think it's a good idea?
Like all things when it comes to COVID-19 and family life, like it's a mixed bag. Like there are no perfect solutions. So it's a great thing in that it does expand our social circles and may satisfy that social need in a contained way. But as you mentioned, you're counting on everybody to follow the same rules. And so then the question becomes, how do people go to the grocery store? What if people need to go to the doctor? That it suddenly takes that contained experience and starts to insert more variables into it. So I think that we just have to weigh everything all the time. So there's the benefit of increased social activity while still having some containment around it. And yet, of course, there may be this sense of security that might be false because there's, almost certainly likely to be more interaction with the outside world than maybe people bargained for when they entered into those agreements.
Yeah, that's so true. Lisa Damour, thank you so much. Always a pleasure talking to you.
Same. Thanks for having me.